Breast lymphedema from breast cancer treatment can cause swelling, heaviness, and discomfort at the breast. In this video, I'm going to show you how to use kinesiology tape to help reduce your swelling and discomfort at the breast because of that lymphedema. I'm Dr. Alex Hill. I'm a board-certified oncology physical therapist and certified lymphedema therapist. Make sure you subscribe to my channel for more videos on how to manage your lymphedema. Kinesiology tape is a stretchy adhesive tape that can be applied to the skin in various patterns. It's thought to work by lifting the skin slightly, which creates space for better lymphatic drainage for that fluid to get back into the system. It works best with movement, so stay active, and if you need exercises for the breast lymphedema swelling, watch my video with breast lymphedema exercises linked below and at the end of this video. Before using kinesiology tape for breast lymphedema, consult with a lymphedema therapist or your healthcare provider first. They're going to assess your tissues and your specific condition and determine if kinesiology tape is appropriate for you and the best application method. It's important to be mindful of the areas that you should not place the tape over, plus some other precautions and contraindications. You do not want to place the kinesiology tape over any open areas like wounds or cuts, over any areas of skin irritation, if you have a deep vein thrombosis or a blood clot, or over any areas of active malignancy. If you have allergies to adhesives, kinesio tape is not for you. Additionally, if you're in active radiation therapy treatment for your breast cancer, you don't want to place the kinesiology tape in the radiation field that you're getting that treatment in. Some other precautions to consider are if you have diabetes, if you have decreased skin sensitivity or increased sensitivity, congestive heart failure, kidney disease, organ transplants, and pregnancy. And finally, the skin should be clean and dry before applying the tape to ensure proper adhesion. The tape will not stick to your skin if there's lotion, oil, or creams on the skin. When using kinesiology tape, it's important to remember an additional couple key points. First, you're just going to cut a small piece of the tape and place it on your skin in the swollen area for 2 days to make sure that you don't have any allergic or irritative skin reactions. Most people tolerate this tape pretty well because it's being used gently for lymphedema, but it's always best to check your skin before you place the whole tape pattern on with a small test strip first. Next, although kinesiology tape can be worn for a couple days before replacing it, if you notice skin irritation, redness, swelling, or discomfort, don't wait, remove it immediately. And every time that you remove the kinesiology tape, always check your skin for any irritation because you do not want to place that tape over skin that's already red and irritated. And finally, kinesiology tape can be a really helpful addition to a comprehensive lymphedema treatment plan, which may also include manual lymphatic drainage, compression like a compression bra, exercise, and skincare. It really should not be used on its own. All right, so all you're going to need is a roll of kinesiology tape and some scissors. The tape can also be purchased pre-cut, and links for both types are in the description below. So the first step is going to make sure that the entire area is clean and dry. We're going to be placing the tape at the breast, as well as down the trunk and across the chest. So these are the areas that you want to make sure are clean and don't have any type of lotion or cream on them. Next, we're going to measure and cut the tape. So we're going to be placing the tape to help drain the breast to the lymph nodes. All right, so you should have one strip to go across the chest and then one strip to go down the side of your trunk down to your groin. Now I'm showing with just 2 pieces, but if you have a very large breast with a lot of swelling, you may find that you can need 2 strips to go down, so to cover the entire breast, and 2 strips to come across the chest to make sure that you have full coverage of the entire breast. Once you have your strips, you're going to cut corners around one end of the tape. This is going to help make sure that it doesn't come up easily once you have it on. Once you have one side rounded, then if you have tape that has lines on the back, you're going to cut vertically along each of those lines, but you're going to leave about 1 inch left at the top. This part is going to be our anchor, so you're not cutting up to there. All right, so once you have your strips, I think this kind of looks like a jellyfish, but it's called a fan pattern. Then each of those strips that you just cut, you're gonna round the edges of each of those. Again, this is to help make sure that it doesn't come off easily once it's placed on the skin. All right, so there's one done. And then just like you cut one into this jellyfish, you're going to cut the other one into that same fan pattern. All right, once you have your 2 strips, then you're ready to place them. I'm going to be placing these over my clothes, but you're going to place them directly on the skin. So you're going to rip at the top part of the strips and the bottom part of the anchor. So I'm going to be placing this anchor at the groin. Again, we're moving that fluid from the breast out and down to those lymph nodes that are in our groin. So you're going to peel off the back, and then you're going to place that anchor right above the hip crease, right above the groin. You're then going to rub it. That's going to help activate the adhesive. And then you're going to peel the back of that strip off about to a ½ inch left so you can hold on to it. And then you're going to pull it about 10 to 20%. So you're not pulling it 100. Usually what I'll do is I'll pull it 100%, back off to 50, 25, a little bit less. And you're going to guide it up towards the breast. And then you'll just repeat that for each of the next strips. So you're going to peel it to the last ½ inch or so of the strip. You're going to pull it 100, 50, 25, bring it up and over to the breast, kind of rub that in, and then you'll go to the next one. Again, you're pulling it 100, 50, 25, a little bit less than that, bringing it around to the side and outer part of the breast. And then the last one, same thing, coming up this way. So they're coming down the side of the trunk towards that groin where those lymph nodes are, where we're moving it down to. So once we have it coming out to the side and down, now we're going to be going across the chest. So again, you're going to rip it at the bottom of the anchor and the top of the fan strips. You're going to peel off the backing of the anchor, and you're going to place that over to the outer part of the opposite chest. We're moving that fluid to those lymph nodes in the other armpit. And again, we're addressing the swelling in this breast. So if you follow my watch, that's the side that we're trying to get that fluid out of. So now you can either go from the bottom strip up or the top one down. Sometimes it's a little bit easier to go from top down, especially if you're wearing lower cut shirts that you're trying to not have the tape be seen too much with. But I'm just gonna start from the bottom. And again, we pull to the last part of the strip right here that you can see. We're pulling 100, 50, 25, and you're bringing that across and down, and you can kind of follow the shape of your breast. Again, if you have a larger breast that has a lot more swelling, you might need to bring it farther down and use multiple strips than just these 2 that we have here. We'll go to the next one. Again, we leave that last little bit so that we can hold it. Pull 100, 50, 25, and we're laying it across. And it's okay if you come over to that other side of the breast. This is a lot easier to do if you are doing it in front of a mirror. So I would highly recommend that. So again, we're pulling it over and across that light tension. And if you find that you've cut them too long, then you can always clip them back. So if you don't want it coming all the way across, you can just simply cut and round those edges so that it's not coming all the way across. All right, and then we just keep going. So this next one, again, 150, 25, a little bit less. Gonna use the camera as my mirror here. So we're bringing it all the way across, just like that. Again, it's okay if they overlap. All right, and then we're bringing that across. And then we've got the top one. So again, peeling that. And coming up and over. Okay. All right, so now we've got the tape placed. So again, we're moving that fluid out to the opposite armpit and down to the groin on the same side to help with moving that fluid out. When this tape is on, you can still use your compression garments if you have compression bras. Again, this tape is just an adjunct to help with further reduction of that swelling. So on the breast itself, the tape would be coming from the inner part of the breast out to the opposite armpit, and then from the outer part of the breast coming down the side of the trunk. So you should be coming around the entire breast from the top and the bottom, from the inside and from the outside, making sure it's completely covered with that tape. Now, if you also have swelling in the arm and it's not just in the breast, you can also use a tape pattern, which is very similar to this, at the arm to also help with reducing the swelling if you do well with the tape. I have a video on how to do the kinesiology taping for the arm lymphedema at the end of this video. You can keep the tape on for up to 5 days. However, I typically recommend for people to only have it on for 2 to 3 days if you have lymphedema, just to avoid any type of irritation that can occur at the areas that we're placing the tape. When it's time to remove the kinesiology tape, you want to go slow, and as you peel it off, you're going to hold down the skin and gently peel it back, and that's going to help make sure that you don't cause more irritation at those tissues. You can also rub in some Vaseline or oil like coconut oil or baby oil. That's going to help reduce the adhesiveness as well and make it easier to peel off. I hope you found this video helpful on how to use kinesiology tape to help reduce the swelling of the breast lymphedema that you have. Please like it if you found it helpful and share it with anybody who might also find it helpful to reduce the swelling, and make sure you subscribe to my channel for more videos on how to manage your lymphedema.